Early versus late parenteral nutrition in critically ill children. Definitions. Parental nutrition is the feeding of a person intravenously bypassing the usual process of eating and digestion. The person receives nutritional formulae that contain nutrients such as glucose, salts, amino acids, lipids, and added vitamins and dietary minerals.
After a few days of critical illness, children develop profound macronutrient deficiency, which may be associated with infections, delayed recovery, and prolonged mechanical ventilation. Enteral nutrition is the preferred method of meeting the macronutrient requirement. If enteral feeding is not possible, however, or fails, parenteral nutrition is advised. But evidence to support the timing and benefit of parenteral nutrition in critically ill children is lacking. In a multi-center study, 1,440 critically ill children from newborn to 17 years old, with 45% under 1 year old, who were admitted to the pediatric intensive care unit and at risk for malnutrition, were randomly assigned to either early or late parenteral nutrition. Early enteral nutrition was attempted in all patients, and they all received intravenous micronutrients and a similar volume of fluid. Analyses of the co-primary outcomes demonstrated that patients who received late parenteral nutrition were less likely to acquire new infections while in the intensive care unit, and needed intensive care for less time. The mortality rates across predefined time periods did not differ significantly between groups. There were significantly more hypoglycemic events in the patients in the late parenteral nutrition group. Thus, withholding parenteral nutrition for 1 week in critically ill children in the pediatric intensive care unit, as compared with initiating early parenteral nutrition, is clinically superior, with fewer new infections and a shorter stay in the intensive care unit. Full trial results are available at nejm.org.
Applications in medicine. Total parenteral nutrition is provided when the gastrointestinal tract is non-functional because of an interruption in its continuity or because its absorptive capacity is impaired. It has been used to comatose patients, although enteral feeding is usually preferable and less prone to complications. Parenteral nutrition is used to prevent malnutrition in patients who are unable to obtain adequate nutrients by oral or enteral routes.
The type of feeding tube you received in the hospital was determined by your doctor. The decision was made based upon the function of your GI tract and the length of time tube feeding was likely to be needed. Some feeding tubes are appropriate for a short period of time, typically less than 30 days. Others for longer-term tube feeding. A nasogastric or NG tube is inserted through the nose and down into the stomach. This type of tube feeding is typically for short-term use and will not be covered in this program. Please contact your healthcare provider for more information. A nasojejunal or NJ tube is inserted through the nose and down into the jejunum, the second part of the small intestine. A gastrostomy or G tube is placed directly into the stomach through a hole made through the abdominal wall and into the stomach. This hole is called a stoma. G-tubes can be placed surgically or non-surgically. A type of G-tube placed with an endoscope is known as a PEG. A jejunostomy or J-tube is placed directly into the jejunum through a hole made through the abdominal wall or through an existing G-tube. A J-tube placed through a G-tube is called a G-J-tube.
Pros and cons. Pros. Short-term parenteral nutrition may be used if the digestive system of a person has shut down and they are at a low enough weight to cause concerns about nutrition during an extended hospital stay. Long-term parenteral nutrition is occasionally used to treat people suffering the extended consequence of an accident, surgery, or digestive disorder. Parenteral nutrition has extended the life of children born with non-existence of several or severely deformed organs. Cons. Possible complications such as infection, blood clots, fatty liver and liver failure, hunger, cholecystitis, gut atrophy. Issue apply in Ecuador. In Ecuador, the rate of malnutrition declines by 18 points in the last 20 years. Conclusion. Many people of total parental nutrition at home in the United States, and because total parental nutrition requires anywhere from 10 and 16 hours to be administered. Daily life can be affected, also a daily lifestyle can be changed. Most patients agree that these changes are better than staying at the hospital.